Very interesting, right? It was a case of disseminated abdominal tuberculosis. And it was a 34-year-old male who presented to our OPD with all the features of gallstone disease, or basically chronic cholecystitis, and was planned for laparoscopic cholecystectomy. And during the intra-op, when we did at BL, we found these kind of tubercles all over the abdomen, along with multiple adhesions between the intestine and abdominal wall. So in this case, we just want to highlight that in third world countries or the low income countries where tuberculosis is still prevalent, as we know, this abdominal tuberculosis can mimic any intra-abdominal pathology, be it an appendicitis, cholecystitis, like in this case. So it's important to keep this disseminated intra-abdominal tuberculosis in a differential diagnosis of all the patients that we are getting of different intra-abdominal pathologies in countries where tuberculosis is still prevalent. So what can be the types? It is basically divided on the basis of which part of abdomen the tuberculosis is infecting. It can start right from esophagus to the stomach, to the small intestine, to the large intestine, to peritoneum, appendix, gallbladder, and each and every organ in the abdomen. It can affect the peritoneum and may lead to the manifestations like ascites or multiple adhesions between the peritoneum and the bowel. The patient can present with obstruction. It can affect the bowel in the form of ulcerative lesions or hyperplastic type of tuberculosis. So basically this is intra-abdominal tuberculosis. It's also known as master of disguise because it can mimic any intra-abdominal pathology. So this case was just to highlight that this can be a differential diagnosis in multiple different intra-abdominal pathologies. So what is the management? Management is same. It's the anti-tubercular treatment that we do for tuberculosis. And we also had patients who had disseminated intra-abdominal tuberculosis, and with the anti-tubercular therapy with HRZD, the patients were able to recover completely and able to get the surgery done again. And these intra-abdominal adhesions, they may remain even after the treatment, but these tubercles just disappears after the treatment. It's interesting, right? So share it with people, and thanks for listening.